Spring has sprung, and we're starting to see people who are getting stung by various insects. The ones that cause severe allergic reactions are the bees, the wasps, and the hornets. There are actually two different hornets, one wasp, honeybee, which cross-reacts with bumblebee and yellowjacket, that cause life-threatening reactions. There's two basic types of reactions that these stinging insects cause. First of all, they can cause a local reaction. Secondly, they can cause a systemic reaction. Local reactions are just what they sound like, local swelling. Two things cause that. One is the venom itself. The second thing is a patient can be allergic to the venom, which causes local swelling. This kind of allergy is, I don't want to be make things too confusing, but it's what we call cell-mediated allergy. It comes on slow, the swelling increases over a period of days and then can take days or even a couple weeks to go away. And it's an allergic reaction. With a sting from one of those insects I mentioned, it's almost never infected. So you don't usually need antibiotics, which is a mistake I often see, but rather antihistamines and maybe a topical corticosteroid or steroid cream. Now, the systemic reaction is the dangerous one, and that's the one where you really need to see an allergist if you had one. That would be symptoms away from the site of the sting, like hives or wheezing, or if you get lightheaded because your blood pressure drops, or God forbid you lose consciousness. That is called a systemic reaction. People die from that, and it can be treated really successfully. 3 ways to treat allergy: avoid stings. The second is medication, and with a systemic reaction, we talked about how to treat local reactions, but with a systemic reaction, the drug of choice is epinephrine or adrenaline. The exact same chemical is what your body makes from the adrenal glands, adrenaline, in a larger dose. That opens up your airway, raises your blood pressure, and is life-saving, and the faster it's used, the better. So if someone has a systemic reaction, they should use adrenaline immediately. If you've had a systemic reaction, we also suggest that you test and find out exactly which insects you're allergic to. I mentioned those 5 different insects. People usually are wrong when they identify the insect, with one exception. If it's a honeybee, it can leave a stinger. They leave their stinger and they die after they sting you. So if a stinger is removed, then it's usually a honeybee. It can cross-react with the other insects, but the other insects do not leave stingers: hornets, yellowjackets, and wasps. So we can identify what people are allergic to, and then you can do shots or immunotherapy, and it is recommended in people who have systemics because it's virtually 100% protective, preventing systemic reactions that are life-threatening from insect stings. If you've had a systemic reaction, in addition to having an allergy evaluation, and even before you get the appointment with an allergist, your primary care doctor might want to give you an EpiPen. The other product on the market is called ABQ. This is a self-injected epinephrine. It's a single-dose shot which you carry with you at all times during the season when insects are stinging. And at the first sign of a sting, you use that injector. Just last week, I saw a beekeeper. Now, beekeepers get stung, generally, and they should have an EpiPen available in case of a systemic reaction. You're not going to have a true allergic systemic reaction the first time you're stung. It could be the second time, it could be the 100th time you're stung. And so, since beekeepers are at high risk of getting stung, and the first allergic reaction could be a serious one, they should carry an EpiPen with them. If you've had a systemic reaction to an insect sting, please call the office and we can get you treated for that, and we can at least diagnose the problem and help you in avoiding stings and get you set up with adrenaline if you wish to not be completely desensitized.